Today I'm going to discuss C-section scars and how to take care of it. So stick around. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fizet. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Since 33% of women in the US end up in a C-section, I think it's good that we discuss the C-section scar and C-section process. I won't lie to you, all my videos are clear about this. 33% is way too much, okay? My lifetime C-section rate was 10.1%, and I delivered 3,700 babies. There's way too much induction. Why are we getting babies out when they're not ready? They end up in NICU. Watch all the other videos. You're gonna learn so much, and how to avoid a C-section. I have a whole section playlist on that also. So that's a C-section. I did a little mess up here. It's straighter than that. It's about 10 centimeters because that's the size of the baby's head. And if you remember, if you're paying attention, when a patient dilates, we say she's fully dilated when she's 10 centimeters so the baby's head can pass. So it's about the same thing. Sometimes it's a little bigger. And you have to know that there's layers. When I've assisted hundreds of C-sections when my patient ended up in C-section, and when I started my practice, I was helping out gynecologists. So I've seen a lot of C-sections. So we do cut the skin, but then we cut until we get to the uterus. We open the uterus as well and everything. So there's layers, and there's muscle layers. And at one point, we have to grab on both sides. I don't want to be gruesome or anything, but we pull to make way to kind of separate the muscles, because you have the white line here. If you remember the six packs, in the middle they're together. So we have to kind of create a little opening. We don't rip the muscles, but we separate them. So it's normal to be sore after. If you saw how we almost feels like water ski when I did that. And I would always like go, ooh, because I had a cesarean. I know how it feels. The first thing they'll do before the cesarean is make sure you're comfortable. So if you already have the epidural, they will re-inject medication for a deeper level of anesthesia. And if you do not have if it's a planned C-section, they might just do what they call a rashi anesthesia, which is like they don't leave the catheter in, they just put the medication in and you're frozen. If it's an emergency C-section and you did not have the epidural, or somehow they need to get the baby out within the next couple of minutes, you might be put to sleep, but the anesthetist is qualified, so don't worry about that. But then you don't hear your baby crying when it comes out. We also put a catheter in the bladder to make sure the bladder, because if you have a full bladder, let's say you've been receiving IVs, like they pump IVs a lot in labor. Again, not a great idea. But, and then let's say you were on you had the epidural, you did not feel the need to pee, so your bladder filled. And if the bladder is in front of the uterus, there's a danger of cutting into the bladder. It has happened, unfortunately, to some women. So by emptying it with a catheter, we make sure that it's not in the way. The more a woman has cesarean, the more there's scar tissues, and the more it's harder to get to the uterus. A first cesarean is easier because we just push away the muscles and, well, kind of pull away the muscles and everything, and we see the uterus. But once a woman has had like 5 or 6 cesarean, and I've heard 8, 9, that's insanity. Yeah, it's my opinion. But everything is like with fibers, so it's like one giant ball of scar tissue. And it's harder for the and I saw on a Facebook group a woman saying, I'm having my 8th cesarean and I had the preeclampsia. My doctor says I'm a walking time bomb. And she was almost bragging about it, which is like, okay, you've got 8 kids to take care of and you're very high risk. And she had eclampsia and preeclampsia, which is again very serious condition. I think she was like in denial of all this, but it's a very complicated surgery. Also, women that are highly overweight, it's harder to reach the uterus. It takes longer, and there's more bleeding, because once you're open, you bleed. There's little vessels on the skin and in the muscles and in the uterus also. So make sure you're in good shape when you get pregnant, and make sure you don't have a cesarean, okay? But I do a lot of medical missions in third world countries. I've seen the big zipper, like the big scars here where they open like all the way and did not heal very well, because it pulls more this way, of course. And they were asking, like, can you do cosmetic surgery? And we're like, no, we're like in the middle of a school here, and we're just like, doing regular consultation. But there's really not much reasons to do a vertical incision. Honestly, it's unqualified doctors that are lazy. Yeah, that way it's all open, so it's easy. But then for the woman, every time she coughs, every time she bends, it pulls on all those muscles. So it doesn't make sense. A lower transverse incision should be, and if your doctor, your obstetrician is qualified, that's what they do. So you're comfortable either under anesthesia or epidural or the Rashi anesthesia, which is like the shot. So we get the baby out, and then all the layers that we cut, we have to resew them. Some are not being resewn because there's no point, like the peritoneum is like, it's the envelope. You don't have to know that. It's not important. So we reclose everything, but you have a scar here, which is the skin is cut. They can close it either with stitches. I've seen glue. I've seen staples a lot. That's very popular because it goes very fast. And stitches are usually under the skin, so you don't see like thread coming out, okay? Stitches are dissolvable. You don't have to have them removed. They will put a compression bandage for the first 24 hours to limit, like to hold the tissues together so you don't bleed as much. But if you wake up in the recuperating room and you feel like it, because if you were put to sleep, you might have a sore throat and you want to cough, ask the nurse to give you something to hold the scar, because when you cough out, it stretches everything and it feels like they're cutting you again. Okay, I've been there. I've had a cesarean at my first baby, so I know what I'm talking about. You can breastfeed, definitely. Use your either your breastfeeding cushion, okay, or any pillow, so that way baby doesn't push on the scar here, because that can be painful. Don't worry about bowel movement. It's really simple, and most women are afraid, and when they go, they're like, oh, that was it. Okay, so it won't hurt or anything. The main thing, as I was saying, is if you feel like you need to cough, just have a pillow ready, or at the worst, you still have a bandage, so you just put your hand flat and then you cough, so it doesn't stretch the whole like scar. Okay. The next day or the day after, usually they remove the bandage, because wounds heal better at open air, with the exception of clean open air, meaning don't put your fingers in touching all the time. We have bacteria on our hands, we touch all kinds of stuff, we touch our nose, we touch COVID and all that stuff. So don't touch the scar, okay, let it heal. They will remove the staples. I've had a patient that came to my office at the 4 to 6 weeks visit, and she goes, I'm kind of itchy at my scar. So I'm like, okay, let's take a look. She still had the staples. So somehow you're supposed to have them removed, like at least on the first couple of days or even the first week at the most. So that's why she was rejecting the staples. So she did not understood the follow-up appointment, or somehow she fell through the cracks. If I don't know what happened there, but I removed them. I had my little thing, and she felt so relieved. Sometimes they will remove the staples and then they'll put Steri-Strip, they look like Scotch tape that we put sometimes if somebody has a not too deep cut. So same thing, you have the little Steri-Strip. These will fall off with you taking a shower, and just don't worry about them, okay? Again, they don't hurt to be taken off. If ever you have some that are like the glue is really good, always hold the skin and then pull the other part, okay? Hold the skin under it, so that way I don't like the old way, like some nurses, let's take off the bandage and ripping it off. That pulls the skin, and it's absolutely unnecessary. Just gently you hold the skin and but they will fall off when they're ready. At one point, if they're like, it's been a week or two and they smell bad, and because sometimes bacteria will go under them, just remove them. No bath, because it's an open scar, until usually you see your doctor 4 to 6 weeks after the birth, your regular appointment, your postpartum appointment. Some women report having intercourse before seeing their doctor 4 to 6 weeks, then use some kind of birth control. Very, very rare that you would get pregnant you're still like bleeding, not much, but you're still bleeding from the birth. But there's some super ultra fertile women, just like someone every time wins the lottery. Some women like have babies that are like same year twins, I would say, that they get pregnant right after, not right after, but within the month or two after giving birth. It's possible. We've seen it. So if you don't want to get pregnant, and I see in forums, sometimes the baby is 3 or 4 months, but they say, I'm freaking out, I did not want another baby, and I'm pregnant again. Yeah, you have to put your guard down, and you have to be careful. Even if you're breastfeeding, the World Health Organization says you're safe if you're solely breastfeeding. That's not true. They're wrong, okay? I'm going to say it. They're wrong, because if I could fill an auditorium with all my patients that got pregnant while solely breastfeeding. So it happens more than you think. So I don't know why they're saying this. They're wrong, okay? Put your comments below if you got pregnant while breastfeeding, but it happens a lot. So getting back to the scar here, they say I was reading an article. They were saying it goes white. It takes about a year. The first months, it's going to be like pinkish, red, and then pinkish. It could be a little, how should I say, swollen in the beginning, and then the swelling gets down, and they say it gets white. That's true, because it's scar tissue, so it's more fibrous, so it's less stretchable. And they say it could get to skin tone. I have not seen it, and I've seen a lot of scars. It shows it's white, so it's your souvenir. So keep your scar clean. They say a mild soap and water, but then you're using your hands, so just water. If you have a shower massage, you just not too hot again. Okay, things that should alarm you if the pain increases. The first 2 or 3 days you need painkillers, because it's a scar, and you've had surgery, so it's normal. But if after 2 or 3 weeks everything was going fine and now you have more pain, if you have like a lump under it, that's usually like an abscess that's developing. If it opens, I don't want to be negative, I'm just telling you here. If it opens, and usually when it opens, we cannot reclose because there's bacteria on it, and then we're going to do an abscess if we reclose everything. So it has to heal from the bottom up, so it's going to be longer to heal. Okay. So if you do a fever above 100, that could be again from breastfeeding. You could have a mastitis, but you should consult the maternity room or your doctor if he or she is available. The elephant in the room is the psychological scar of having a C-section. Maybe you were planning a natural childbirth and you had all your heart set, and there was no way you could imagine having a C-section, and sure enough 1 out of 3 end up in a C-section. If you're fine with it and you said meh, some women are like, I don't care, I don't mind, it happened, I was ready for that, all my friends had C-sections. Fine. If you feel like it's dragging on, if some women even talked about the C-section, they compared it to being raped, okay, because they were not listened to. There were some comments, there were some touching, and because you're naked, you're on an operating table, not everybody lives it the same way. If you feel like you've got post-traumatic stress syndrome, consult. And it's very hard to talk to people about this, saying I had a C-section and I'm not okay with it. I'm having nightmares, I'm having problems with it. Because most people will say, you have a healthy baby, what's your problem? Just have the next one, you'll have a C-section. And some women say, I never want to go through that again, and so forth. And there's a lot of videos about VBAC, vaginal birth after cesarean. I'm a VBAC myself. It exists. I'm here to talk about it. But seriously, if you feel like you're not well with it, there's a grieving period. Like you had a plan, you had, sometimes people have birthing plan, and your plan did not go as you expected, or you felt like you were not listened to, or you were not respected. Make sure you get the proper help, and talk with other people. But like I said, most sorry, my nose is itchy. I should not touch my nose. I'm gonna wash my hands, don't worry about it. But it's just, I'm holding this. So yes, so consult if you have to, if you feel like it is unresolved, because you don't want to get into another pregnancy having all these fears and you know, the nightmares or whatever. It does heal. It takes about a year to have it white. And then some of my patients came to the office after 2 months and said, I feel the pulling, as if, you know, almost like, oh, my C-section scar is pulling, it's going to rain or whatever. And we found, and it pleases the mind more than, it's not scientifically proven in any way. See, I'm a doctor and I'm giving you non-scientific not advice, because it's never an advice. This is all for entertainment, but things that we did. So they just did little massages here. Once the scar is closed, we're talking 2 months after, to kind of re-separate the layers, because if all the layers are stuck together, and sometimes even the intestines gets tangled in that, and it's really pulling. If you're coughing, you feel like everything is just, like I said, a giant ball. So by massaging, you're separating the and there's some physical therapists that actually do C-section recovery and everything. So again, you might want to consult and go from there. So I hope I did not stress you out too much. I'm sorry. I had to say it, because 1 out of 3 is a lot, but you have to know what you're getting into. I've had, if it's okay if you only, I check the stats, if you only watch 10 seconds of it, say, I don't want to hear about it. My patients, there were 2 ways. Some said, yeah, tell me, like if they had a C-section, tell me everything you're doing. And others were saying, I don't want to hear anything. I just want to hear the baby crying. Don't tell me what you're doing, because it was like a lot for them. So I totally understand if you clicked, you stopped the video after 10 seconds, and there's plenty of other videos you can watch. See you on the next one. Bye-bye.